I start off today with just mentioning globally there's 1.86 million cases of COVID-19 and approximately 115,000 deaths. Again, it's just a reminder that this is impacting not just Prince Edward Island in terms of what we're doing, but really every part of the world. In Canada, there have been over 24,000 cases of COVID-19 and over 700 deaths. Our case fatality rate in the country, 2.9%, which is actually a little bit less than the overall global fatality rate. Our hospitalization rate with the cases in the country is about 18% of all those of our cases, and 28% of those who are hospitalized end up in intensive care. In P.E.I, I'm happy to tell you that there are no new positive cases to announce, but we have also received 175 negative tests back over the weekend, which is also good news. 23 of the 25 cases of P.E.I are considered recovered. We've done over 1,900 tests, and that number of tests per population is actually just a bit above the national average. And I think this is really reinforcing that what we are doing is making a difference, but we need to keep going. And it's a reminder to me how different this could look if we even just have one outbreak resulting in a number of hospitalizations and deaths. This really reinforces to me that all islanders need to work together while we stay apart for this to work and continue to work effectively. COVID-19 is affecting such a range of people across the globe. Our vulnerable populations certainly are a major concern, but many are being affected. And we should continue to take this seriously for ourselves, for our friends and family, and for every islander. I've had a number of questions over the last couple of days about the ferry service between Prince Edward Island and Nova Scotia, which is set to begin on May the 1st. But I am sure that this ferry season will not look like other ferry seasons. And similar to our Confederation Bridge and airport, there will be screening at Northumberland ferries. And we'll be discussing with highway safety as well as public health officials about that screening process in terms of essential versus non-essential, as well as health screening and self-isolation plans. I have not done so yet, but I look forward to having a discussion with Northumberland Ferries Limited in the days ahead so that we can continue to plan, and we'll have more information for islanders as we go forward. And although the majority of islanders and the large majority of islanders are taking this very seriously and following public health measures, and we're so happy that people are doing so, we are still seeing some examples of those who are not listening. And we appreciate certainly not only how well people are doing, but we appreciate the concerns that are being called into us. We have had over 200 calls into our line, resulting in over 100 door knocks or visits to people's homes or dwellings, resulting in a large number of verbal and written warnings, police referrals, and 4 charges have been laid. We've also received a lot of feedback on the decision that was taken in conjunction with environment to delay the recreational fishing season. And the decisions are not taken lightly, and when we make these decisions, our primary concern is for the health and safety of islanders. And we're watching closely what is happening around the world, across the country, to try to make sure we keep our population as safe as possible. And we are regularly reviewing not only the decision around recreational fishing in our province, and we certainly will happily reconsider a delayed start date when it is safe to do so. I think it is too early to make that decision today. And because I do not believe we are comfortable saying that this is over yet when we're in the middle of a worldwide pandemic. We're all facing challenges at this time. People are unable to work, children who are not at school and have not seen their friends, islanders who cannot see their loved ones. So for these reasons, and many more, including the recreational fishing season, we hope that we can make announcements and give direction about when we can make changes about some of those start dates. And I think that leads into my next comment about it's difficult to put any kind of timeline on these measures that we've put in place for many of these things that we're doing. However, we do know that the length of time it will take is heavily influenced by our adherence to these public health measures and what happens, of course, to the virus and the pandemic around the world and in this country. If we are following public health measures, self-isolating after travel, staying home as much as possible, practicing physical distancing when we're out, it will make a difference. We are already seeing that difference that it can make here in this country and in this province. And so let's keep doing that. Thank you.